Hi, my name is Dr. Chiang Wen. I'm an allergist practicing at Chiang Children's Allergy and Asthma Clinic. I think pediatrics is a very interesting field. You see children in all spectrums of life. You see them from very young. They can be little babies and little incubators all the way up to grown-up children, teenagers and adolescents. The spectrum of being able to watch them grow up, to be able to see them through their ups and downs, to be able to see them through illnesses, I think is great fun. On top of that, I think being able to interact with the children and being able to interact well with or reassure the parents to be able to communicate is a skill and probably something that I enjoy a lot. I think the challenges in my field is that if you have a very sick child, someone who is young and vulnerable, parents are absolutely anxious, sometimes devastated when the prognosis or the outcome of the illness is very bad. I think that is a challenge, and we've often faced that in some of the children that come to see us. Being able to communicate to them maybe how we can get the child better, or maybe sometimes we can't get the child much better, is sometimes difficult. So those are the challenges we see. I think having compassion, having empathy, being able to interact well with children as well as their parents is very important. Sometimes being able to understand the different stages in a child's life, to be able to see what's a good probably communication tool to start off with when they are at a certain age would be useful. I think in most pediatricians, one of the joys is being able to see the child through illness and being able to pick them up even when they're ill, to be able to communicate with them even when they're ill. Start off in the mornings, probably with a nice breakfast with the kids, and then after that I bundle down to work and probably start my ward rounds in the hospital. This is followed by a day in the clinic, running around, probably seeing patients, quick lunch, and then patients in the evening again and ward rounds. I think it's not much difference whether I work in a hospital or whether I work in a clinic setting. The routine is almost the same. I think pediatric allergy is quite an interesting field. It's been something that has been almost like a tsunami in the last decade or so. The fact that food allergies are on the rise, eczematous children with bad skin are on the rise. We have rhinitis, which is nose allergy, and asthma is a problem nowadays. So I think in the area of allergies in children, it is something of an increasing burden in developed countries. So I think it's interesting, and it's a very interesting field because we see a different spectrum of it, and we see different severities of children coming to see us. In the area of where I practice, food allergy and eczema actually ranks quite high. In these areas, for diagnostics, we do a good history, and then we usually do skin prick testing for the children and sometimes blood tests for the children to be able to determine if the children have food allergies. In the area of rhinitis and asthma, we do help with diagnostics with skin prick testing for environmental allergies. We sometimes do lung function testing to ensure that the lungs are stable. We also offer sublingual immunotherapy for children with bad nose allergies, rhinitis, to be able to overcome dust mite allergy. I think allergies in this present day and age can be managed. It is good for the patient and the child to have a good understanding of their allergies so that we can manage it better. It actually affects the quality of the life of the child and the parent if these allergies are poorly perceived, poorly managed. And therefore, in my view, I think if we can help these children and their parents to have a better quality of life to manage their allergies, they should be managed.